Hello, everyone. I'm here today with Dr. Mark Nolting, and he's from the state of Washington, Edmonds. Is it Edmond or Edmonds?
Just north of Seattle.
Oh, okay, Seattle. All right. There's a lot of interesting medicine happening in the Seattle area. I think the first doctor that I was exposed to up there was Jonathan Wright, who is not in the everyday as much as he used to be. But I'm so happy to have you to be able to send my readers to and expose my readers to this new kind of medicine. And one of the things I thought was interesting about you is cardiovascular disease as it pertains to age management. So here I am in my 70th year, and I never thought about high blood pressure, but I have high blood pressure. Everybody I know has high blood pressure. What's that about?
Well, part of the increasing blood pressure is because of the stiffening of the arteries. So it's all about that endothelial lining of the arteries. Mm-hmm. And as we age, it's a consequence of basic general aging, but it's also something that we can have an impact on.
And you know, the normal thing is someone goes to a cardiologist and they get high blood pressure medicine. For a patient like myself, who so far I have not taken a pharmaceutical drug in the last 20 years, except for once when I had my stem cell breast regrowth and I took anesthetic. But other than that, even after that surgery, I didn't take painkiller. I took white willow and it worked so well. Mm-hmm. So there are a lot of us, as you know, because you're seeing them coming in and out of your office all day long. So is there an alternative to high blood pressure medicine?
Yes, there are some effective herbs. There are different kinds of supplementations. I mean, magnesium on one hand is one that you hear a lot about. Herbally, you hear about hawthorn berry and some other types of herbs. And if they're dispensed in the right dosage and the right kind of application, then they can be quite effective.
Magnesium.
But blood pressure has a lot of potential causes, so it's important to get to the root cause, of course.
Is the root cause generally genetic, or is it diet and lifestyle, or other?
Yes, it's all of the above. So genetics plays of course a key role. And you know, the thing about the genes, I think that we've been hearing for the last 10 years now, is that they're not this static thing that we used to think they were. And we can affect it through diet and lifestyle, exposure to toxins in the environment, even our attitude, and you know, our sort of what I call our spirit is all can adversely affect, or on the other hand can help us in these kinds of situations. It can affect the genes.
I often think genetics could be passed on, diet and lifestyle. You know, well, my mother had high blood pressure and her mother had high blood pressure. Well, you all, you know, drank a lot of alcohol.
Yeah. You know, in traditional Chinese medicine, which I always have to throw a little bit of that in because I train in traditional Chinese medicine as well as naturopathic medicine, there's the underlying sort of energy or seed is passed to us by our parents. Of course, we would say that partly means the genes that are passed on, but there's really more to it than that. There's a what they would call an essence that's passed on from parents to child. And if you're raised in a poor environment and your parents were alcoholics and that type of thing, then you're kind of a few points behind, I guess, when you start. So that's the way we look at it. And in Chinese medicine, that's related to the kidneys.
Interesting.
Yeah, it's very
interesting. I was fascinated that you actually lived in China for a while, or studied in China for a while, right?
Well, yeah, I'm a little behind you age-wise, but not too far. And so, gosh, 1984,
Uh-huh.
I went to China with a small group of students. An osteopathic doctor at the time took us over there, and we studied for several months in Chongqing, which is quite a bit inland from Shanghai. And that was China about 30, 35 years ago, was way behind. It was about 40 or 50 years behind time-wise in terms of their society and building and all. So that was my first trip over there to study
China. Chinese is it's the oldest society, I think. Is it 5,000 years old? Their medicine is 5,000 years old.
Well, I lose track after about 5,000 years.
First time I went to China, yeah. I was impressed by what we would call an apothecary, and I don't know what I guess they're herbalists, but many of pharmacies, which are not pharmacies because it's all herbs and roots, and the pharmacist, whatever you would call that person in Chinese, would be putting herbs and roots together. And it appealed to me so much because I asked, in one of my books, I asked one doctor, how did American medicine become this allopathic? Here's the symptom, here's the drug for that symptom. And we are a pharmaceutical society right now. And that is why I find your specialty of naturopathy so interesting, because you, to me, frankly, have more freedom. If somebody has cancer, you can give them vitamin C, whereas a traditional oncologist cannot. You must enjoy.
That's true. It's changing, though, which I think is really positive.
Changing in what way?
Well, even, this area, Seattle area, where we've had Bastyr University for, 30 years now. The medical community here is generally very open to alternative medicine, and a lot of my colleagues, naturopathic doctors, are working in hospitals now. And, so I think there's a nice, good working relationship here, even if that isn't happening everywhere.
I'm glad to hear that. Do you think that Google being located in Seattle has an effect on your business, because that's a younger millennial, more open to new ideas kind of environment?
You have to be careful the way you say that. Up here, they would say that was Bill Gates and Microsoft, and then Google came along a little bit later up here.
Okay, all right. Whatever the order is, whatever the pecking order is.
Of course, if you go into downtown Seattle now, it's 90% Amazon, so they've kind of taken over.
Well, that's true. Okay, so, but that's a young environment also.
Sure. Yeah.
At my age, I am very open to alternative and naturopathic and homeopathic, as you know.
Yeah.
But my friends are mostly allopathic all the way, and I see a degrade that I find alarming, that is accepted in the baby boomer generation, as this is the way it goes. The hips goes, you take the medicine for that, which creates the side effect, which causes another medicine, etc. When a patient comes to you who's never entertained the idea of naturopathic or homeopathic or Asian medicine, but clearly they're sold because something didn't work the other way, and so they found their way to your office, or they watched this, or they watched this interview and went, he looks interesting. What's your first meeting like with a patient?
Well, I guess sometimes I channel Dr. Bastyr, who is the namesake of Bastyr University. It really epitomized what I think at the root we're trying to accomplish as naturopathic physicians. He was a doctor who he birthed many of his patients. I mean, he delivered babies out of his house in Seattle, and he practiced homeopathy and herbal medicine. He even dabbled in some acupuncture. And at the same time, he was well versed in every general medical field. I mean, it's amazing the spectrum that he crossed. I mean, it was very eclectic. But anyway, I did have a brief chance for the first couple of years in my training where I was able to interact with him, and he came in and was guest lectured in classes, and I had him in the clinic. But one of the things that I hear a lot in my head, particularly when I have patients that are very complex and complicated, and they've been to all the, the conventional care, I hear him saying, it's very simple medicine. It's common sense medicine. And so when I get in that situation where I'm going, oh my God, what am I going to do? I settle back, take a deep breath, and just try to listen to the patient. And a lot of times, just that listening part, particularly if we take 10 minutes to do that, I've already exceeded the typical length of a conventional medical visit.
Right. By 4 minutes, yeah.
Yeah, so people really appreciate that, and I think, again, that's the place I start. That is having a good ear and listening and trying to not just decide what I can create for this patient and how can I make them feel good and they'll come back, but really just listening to them and try to find out what their basic complaint is. And if part of it is they don't have a good answer for what's going on with them, then we work together to try to find out what the solution is, how we're going to work at this.
I am, needless to say, not a doctor, but I find the more I become ensconced in this kind of information, which I find so fascinating, I become just the worst thing. The couch doctor who sits and analyzes people I see on television with thyroid problems and look at his eyebrows and look at the sagging skin and all that. But I'm sure that plays a part in it when you have a new patient sitting across the table from you. I'm sure you're looking at body language, facial features, etc., right?
Well, physiognomy, that term where you're reading the face, which is also part of traditional Chinese medicine, probably dates back to Ayurvedic medicine, which I think even predates Chinese medicine. But really, it's, the first impression of somebody is looking into their eyes and trying to determine, is there that sparkle in the eye? Not just from the light, but there is a sparkle that's associated with somebody that's feeling good and they're in good health. And I have patients that come in and I don't see that sparkle at all. It's like flat. And so that's one of the first places I try to work on with the patient. Short of finding a remedy or a drug or acupuncture or referral to another doctor, it's trying to figure out how we're going to get that sparkle back.
Right. I do notice as people age that certain things happen that I don't think have to happen, but maybe you can confirm that. Yellowing of the eyes, red watery eyes, itchy, unhealthy looking eyes. What does that say to you?
Well, first thing I'd say is what the context is, because if somebody's feeling like that coming into my office today, I know it's the tree pollen.
Yeah, that's true.
The eyes are watering.
I'm watching it blow out my window here.
Right, and people, in terms of the environmental influences, people say, well, I'm not allergic. Nobody has told me I have allergies. Well, it's not about allergies. It's just about overload. And so, our environment is a constant overload, either of natural substances, pollens, that type of thing, or diesel fuel. My colleague, Dr. Pizzorno, who was first president of Bastyr University, he wrote a book recently. I'm sorry, it just came out recently about toxins and discussion of how to examine the environment, what kind of toxins are affecting us. And I know he had a piece specifically on diesel fuel, diesel oil. And I'm thinking, as I'm driving down the highway, sucking up that exhaust from a school bus or a truck, that can be very detrimental to us. So, it's important to think about the context. as you scratch your eye.
I know, because I'm looking at the beautiful blossoms in front of me, blowing all over the place, and it's making me have imaginary itches. But I do know that allergies outside of pollen, allergies are out of control. I'm married to a man who is seemingly allergic to the world. He never was, but he can't drive our car anymore because of the outgassing of formaldehyde from the dashboard, and also the electromagnetic field that comes from the driver's side. If we move him over to the passenger side and I drive, I'm not getting hit by it. So I guess we all have a different tipping point. But these are things you could not have studied in medical school because this is all so new, these new environmental hits. This electromagnetic radiation, this coming at you and me right now from our screen. You know, and I see people wearing those bracelets that will tell you how many steps you've walked, and I think, what kind of hits are you getting from that? And what's the cumulative effect on each individual human body, because everybody reacts differently? Are you doing that kind of detective work in your practice?
Probably with virtually every patient that comes in, there's a certain level of detective work. I'm doing more and more hormone replacement these days, which I know you know a lot about, and helping to get the hormones balanced again is something that 10, 15, 20 years ago we didn't really think about a whole lot. But as time has gone along, and again, being up here and in shouting distance of Dr. Wright and other doctors who have pioneered the bioidentical hormone replacement field, we now have another very, very important tool that we can use to help patients try to bring their hormones in balance and work with their diet, work with detoxification. We have a lot of tools at our disposal. I'm really excited about the hormone replacement because when you start looking at what testosterone does in women as well as men, it's just something that, conventional medicine still doesn't pay much attention to that, as you know, particularly the testosterone in women. Since we brought that topic up, can I mention, this month, there's a group of doctors getting together at the Age Management Medical Group, down in Florida, I think, this year. But they're getting Dr. Donovitz and Rosier and a number of the other ones internationally. They're actually going to come to, for the first time, if you can believe it, a consensus on testosterone in women. There has not yet been even a medical consensus of how to approach that. There has been, of course, for men, because, lots of men like to figure out what to do with men. So anyway, it's I think getting back to your questioning about, how to approach patients and really what we have at our disposal, I think it's another area that is expanding, and, it's just, we have incredible resources now.
I think hormone replacement, in particular bioidentical hormone replacement, is the game changer in terms of aging. I don't know who I'd be, what I'd look like, what I'd feel like, what I'd act like if I wasn't hormonally balanced. And it's been an incredible gift. And for people who are watching this interview right now, if you're not understanding what's happening to your body, Dr. Nolting is the kind of doctor who does understand this. Now, you mentioned BioT and Dr. Donovitz, Donovitz. Now, his method is pellets, correct?
Right. He's one of there are a number of companies around the country that train doctors in using the pellet system, which is a vehicle of replacing the hormones, basically.
Right. Yeah. There's different ways for the people who are watching. There are different ways to administer bioidentical hormones. You can do it through cream, which for me, the cream works really great because I absorb. But my husband wasn't absorbing cream at all, and so I give him his injection every Tuesday. And don't call us on Wednesday.
I have in my patient population, I have patients that are, of course, doing the pelleting. I have other patients where the creams and the topical transdermal solutions work perfectly. I have others in my population, generally some of the younger set that do the intense workouts every day that like to do the injections. And they all have their pros and cons. And, you know, in the end, it's all what is suitable for you. And once you understand, you know, the ins and outs and daily application versus, you know, other systems, then, you know, it's
and for those who are watching, Dr. Nolting is explaining that hormone replacement is individualized, meaning what I need is different from what the next woman needs. What you need is different from what my husband needs. We all are unique individuals, as we've been told since we were children. But at this stage, putting back what we are losing or have lost in the aging process is the simplest way to explain this new way to age, hopefully take advantage of this extended life we're all getting in optimal health. When you and I am a little older than you, but when you and I were kids, our grandparents died in their sleep. Do you recall that?
Yeah, I remember that. Yeah.
Remember that? And now death is a long, drawn out, expensive, torturous experience. And I think what you have chosen to do with your life is the defense against that, of take today and look at it as the beginning of your life to change the way you're living your life. Is that part of what you're trying to teach to your patients? Because you're a teacher at the same time.
Yeah, I like that. I like to think of myself as that's my first, you know, what I'm first presenting to a patient is I'm here to listen, and I'm going to help teach, and we're going to learn. In some cases, we learn together because you know yourself better than I do.
Right.
And I'm sort of helping to pull out and draw out, you know, what's locked in there.
Right.
So I like the doctor as teacher is a very comfortable concept. Yes.
Yes, and it's all. There's also a responsibility on the part of the patient to be as informed as possible, too, so that when they finally get in front of you, that you don't have to start at kindergarten, that you can really go to work right away.
And that's a challenge these days with Google.
Yeah. Oh, yeah. Yeah.
You know,
yeah. It's a good news and bad news.
Yeah, and I like it because, you know, hey, we've got the world instantly at our fingertip, but we also have misinformation at our fingertips. So, you know, we do have to sort through that. And I think it's where a doctor who understands that will work with their patient to try to sort out, I guess, the truth of the matter.
Right. And the truth for each patient, which is so different.
Right.
I remember my husband 20 years ago, I said to him one day, "You're like our old cat. You sleep in the morning, you fall asleep in the afternoon, you sleep while I'm making dinner, and then you want to sleep after dinner." I said, "You've seen what hormones have done for me. Why don't you go to one of my doctors?" And I find with men, the first thing they say is, "Oh, I don't need any help there." You get that? This defense of, you know, testosterone must mean I'm not, you know, of the world and sexual.
I love it when couples come in and I get both perspectives, because 9 times out of 10, the couple's coming in because the man wouldn't have come unless his wife is strongly encouraged him and in some cases pulled him along.
Right.
But
and yet once a man gets on it, like my husband, he can't stop telling all his friends about it. And he's frustrated with the friends who aren't doing it because he's found an edge in life.
Yeah, once you get that feeling and you can understand what happens for things starting to get more imbalanced. And I mean, we're not stopping the age process. You know, we're trying to manage it better. So I like the term age management more than I do anti-aging, but you know what we're talking about.
Right. But you can use age management. It's your business. Yeah. Now, back to cardiovascular disease, is that, if I'm coming to Dr. Nolting, is that what you're known for? Or is it the whole spectrum?
Well, I guess when you've practiced over 30 years, there are lots of little pieces to the life history. So, people find out about me different ways. Some people know that I routinely go to China, and I work in China. Every 3 months I go over there and I work with patients there. So that might be one way that people discover me. People may be referred to me just for acupuncture because they may have heard about, I used to teach at Bastyr University, that type of thing. And then other people are, I'm a naturopathic physician, they see my bio and they go, oh, I heard naturopaths can work with this or with that, or they come in for diet management. So it's pretty much a family type of practice, though I don't really do pediatrics anymore. But as I've gotten older, when I passed 50 years ago, Jack Benny, when I got to 30, I stopped counting, right?
You give your age away because the 30-year-olds go, who's Jack Benny?
Yeah, right, I know. I am the oldest one in my office, but all my staff, it's the same way. I mentioned, they don't know who I'm talking about, right? But, it's interesting. I've always, even when I started my practice, I was always interested in, at that time, we called it geriatrics. And we talked about working with seniors. I'm real kind of cautious with those terms these days, but I really like working with the population that's getting older. And that's where the whole bioidentical hormone replacement has come in, the discussion about cardiovascular disease.
Let me interject right in there. Let me interject.
Yeah, sure.
I live in Palm Springs, the Palm Desert area. It's a lot of retirees live here.
Yes.
Everybody drinks at night. Older people drink a lot.
Yeah.
They're not drinking alcoholically, but the cocktail hour is something everybody. I always tell my husband when we're driving around 6 o'clock, be careful. They've just had their first cocktail. What is the effect of alcohol on the stiffening of the arteries? Let's clear that up.
Well, it really has to do with levels and moderation, and different individuals, different bodies are going to be processing alcohol differently. Mm-hmm. Some people get by with a couple beers a day or a few cocktails a day. Other people drink one drink a week and they've got a fatty liver, or they're getting more of that stiffening in the arteries. The effect on the endothelial lining of the arteries is critical, and alcohol at a certain amount can have an adverse effect on that, as can cholesterol and inflammation and a number of other factors. So, it's hard to make a global statement about, every individual, and this is what drinking alcohol is going to do. Personally, I was just going to say personally, when I was 48, I developed atrial fibrillation, which is something that affects millions and millions of people.
That's that pounding heart.
It's that erratic heartbeat that sometimes comes on suddenly. I think it's the second leading cause of admission to emergency rooms. Mm-hmm. And what I found out early on was, after 4 hours, my heart zipped back to normal. And I'm saying, well, this is weird. So then I really, once you have your own kind of symptom or problem, you tend to spend a lot of time thinking about it and researching it. So I learned a lot about atrial, as I call it, AFib, years ago, and that's something I've always had a keen interest in. And I do a lot of natural supplementation, that type of thing, to help keep myself from having that erratic heartbeat.
What would those supplements be for anybody who's got AFib?
Magnesium is another one. Taurine is another one. CoQ10 is another one. Those are, I think, among the more critical ones. Right. And it kept me from ever having to have, the electric shock that to get my heartbeat back into normal. So I've done pretty well with it over all these years.
You look healthy. How important is magnesium? That comes up a lot.
Well, you know, I think as an individual mineral, it's critically important. But again, it's about balance and you know, in consort with the other vitamins and minerals you're taking. It can be taken in fairly high doses, at least a bowel tolerance, which, you know, some people will take a couple 100 milligrams and then they'll be in the bathroom a lot. Other people go up to 1,000 and they don't.
Yeah.
So yeah, taken in the right situation for the right reason, and again, paying attention to the balance with all of the minerals and vitamins and minerals is what's really key. I have a colleague about my same age who I called up last year. It turns out that he had atrial fibrillation for years too, and he controlled it, he thinks, exclusively with high doses of magnesium. So
yeah, magnesium comes up over and over, and I remember there was my organic gardening coach, her son had one of those sudden death heart attacks on the playing field.
Oh yeah.
And you know why? Everyone wants to know why. What I came up with by interviewing doctors such as yourself, it seems to be, not always, I guess, you can't be absolute, high electrolyte, high intake of chemicals, processed food, etc., in conjunction with high exertion and low magnesium. And that for children who eat a diet, or adults too, high in processed food and chemicalized food, and if they play tennis or exert, they should probably take magnesium as a cautionary thing, just something. I found that very interesting.
I wouldn't have any argument with that.
Yeah, yeah.
You know, since you mentioned exertion, adrenaline is something that actually is very difficult in people that have the atrial fibrillation, for instance. So, you know, it's a case where you sometimes you have to make adjustments in your lifestyle. I can't really drink, because if I drink too much, then it'll bring on the atrial fibrillation.
Oh, interesting.
They call that the holiday heart in emergency rooms, because people drink on a holiday and then they get atrial fibrillation and they go to the emergency room.
Interesting.
It's a scary thing, but you know, that dropping dead in the kitchen, sudden heart failure, usually that's not atrial fibrillation. It's usually another type of heart condition that can be hidden for years.
Yeah.
So
well,
they're very simple things that people can do for helping to maximize the health of their cardiovascular system and help prevent this, number one cause of death in this country, cardiovascular disease.
Right.
And that's the diet, and that's the diet and exercise and hormone replacement. Testosterone deficiency feeds into a lot of that. Worse situation. And vitamin D. Vitamin D is critical for the health of the endothelial lining of the arteries.
So help me here. We're almost out of time, but
okay.
Vitamin D. The lawyers say you can have 2,000. Some doctors say 5,000 IUs. Others say 10,000 IUs. Others say 15,000 IUs. Where do you find yourself in the vitamin D3 category and controversy?
Yeah, I don't think it should be controversial. I'm up here in the Northwest where they take it for granted that you're going to be deficient in vitamin D. And in fact, I have patients that come in all the time. They say, well, my doctor won't test for vitamin D3 because they assume I'm low, or my insurance company doesn't want to pay for it because it's going to be real expensive, which is totally erroneous. I mean, it's a really bad way to think about it. Given the importance of vitamin D, we should be testing for it, at least getting a baseline to see what the levels are. They're pretty set clinical levels for vitamin D. And we know that at a certain point, there's too much based on the blood test. And so you need to get a general idea of that before you start loading up on it too much. But I think usually people can get by with 1,000 or 2,000 IUs, milligrams, pretty easily. But, you know, if you're already up at a maximum level in your bloodstream, maybe even 1,000 or 2,000 is too much. So I would go at it that way. And in terms of the cost factor and insurance plans not covering it, the simple solution there is find a doctor who's part of a medical group like BioT or other groups where they basically they work with the laboratories to get cash prices that are extremely affordable. Vitamin D shouldn't cost more than $20 as a blood test.
No.
So,
and considering that vitamin D3 is essential for the four most important systems in your body, your endocrine, your heart, your immune system, and your cognitive. It's
sounds like testosterone.
yeah. I think it's a good investment. Yeah. Well, I could talk to you all day. And for those of you who are watching who live in the Washington area, Edmonds, which is what he says is really Seattle, and the surrounding area, if you are interested in bioidentical hormone replacement, he's a specialist in male hormones, female hormones, thyroid, adrenal, cortisol, digestive disorders, detoxification, chronic disease, acupuncture, weight loss, nutrition, regenerative medicine, and aesthetics. I mean, this is your guy. So thank you so much, Dr. Nolting. I really enjoyed it.
All right.
Bye-bye.